Many learners do rely quite heavily on school feeding schemes, and I'd like us to have a discussion about just how much the closing of schools has negatively affected those that have been heavily relying, and just how many do we have, like a scale as to how many children are affected and who receive these food schemes.
Yes, so Flo, actually the National School Nutrition Program run by the Department of Basic Education is one of the most crucial interventions in the country to make sure that every child has access to adequate nutrition. And it reaches 9 million children in this country. So at least we know that despite poverty, despite the gaps in our social grants system, we know that children in poor areas who attend school are getting one solid meal per day at school, and sometimes it is the only meal of the day. And so what this means is that during the lockdown, 9 million children are losing out on that one solid meal per day. Now, this has been a huge source of worry for, I think it was clear from the beginning that a public health crisis would quickly become a hunger crisis. Indeed, it has. It's very concerning to hear reports now of an increase in child malnutrition being presented at hospitals. And we know that already about a quarter of all children in South Africa are stunted from malnutrition. So we have an underlying crisis of child nutrition. But this one very important focus program that gets food to 9 million people, it has now been closed. And so a group of civil society organizations, the C19 People's Coalition, which is about 300 civil society organizations, has taken this up, has raised the issue that actually there is a constitutional right to food. And if government has an existing program to ensure that some of the most vulnerable children get access to it, if it removes that program, there should be some measures in place to provide an alternative way of ensuring that those children have access to adequate nutrition.
And I'd like us to talk about some of those alternative ways to make sure that all children are fed. But you mentioned this underlying issue of malnutrition. And we know on the African continent it's often spoken about. But when it comes to South Africa, we tend to not talk about it too much. How widespread is the issue, and why do you think it's not really a major focus in South Africa? I mean, you constantly hear about malnutrition in other parts of the continent, but you barely hear about it here, and it really does affect children in this country.
I think that there is something very distinct happening in South Africa's food system. On the one hand, we produce plenty of food to feed every citizen and everybody in the country, but we know that at a household level, there's a chronic problem of food insecurity. So whereas many countries are simply not producing enough food and are not able to import enough food, the problem here is not production, nor is it actually distribution. It's people's access to be able to get enough money with which to buy food. So I think that what we have in South Africa is this contradiction of surplus and abundance on the one hand and scarcity on the other. So what's happened in the lockdown for poor households is, on the one hand, many of the poorest households have lost their access to incomes because the adults in the household rely on informal employment, domestic workers, car guards, people working for a variety of informal sectors, people running their own small businesses, street traders, and so on. So there's this loss of incomes with which to buy food. At the same time, the one thing they could rely on, which is their kids are going to get a solid meal in the day, even if they can't feed them at night, they're going to get that meal at school, that has been lost. And at the same time, the lockdown of the informal sector combined with a number of other things has led to the spiking of food prices in supermarkets, which is where most poor people are now having to buy most of their food, as many street traders are closed down. So I think that what we have is this combination, and a crucial question for government is, if you actually, through the lockdown regulations, have removed people's opportunities to go out and seek a livelihood, you have to mitigate that. And this is not a question of discretion for the state. In fact, the right to food is a constitutional right, and there's a specific provision in the Bill of Rights that says that children, every child, not only South African citizens, by the way, but every child in this country has an absolute right to adequate nutrition. And if we cannot get food children through schools, there has to be another mechanism. So I think that one thing that has been done is there's been a top-up in the child support grant, but we now see that that is not going to every child. It's going to every caregiver, and some caregivers, say a single mother, might be looking after many children. And so it's not clear that, in fact, the increase in the social grants is going to make up for the loss of the school nutrition program. Some other countries around the world have made a plan. They're getting food delivered to children, to poor households. And we know that in this country, we cannot get food parcels to the number of people that need them. So I think a key issue that the Minister of Basic Education needs to be indicating is, if we're going to have a gradual, phased-in approach to reopening schools, how can there be assurance that children who are waiting to return to school do not go hungry during that period? There is this crisis, and I think that it's also important that the ministers of basic education and social development are speaking consistently about how children can be assisted to access food. One of the concerns raised in the past week is that the Minister of Social Development is looking at limitations on the distribution of cooked food. Now, many poor communities are cooking and distributing food to children. Now, if that is closed down, then, and the state cannot get adequate food to children, then it means that really the state has failed, and forms of social solidarity where people are trying to feed children are also being closed down. So I think that there's a crucial question, either to get the food to the children or to get adequate financial compensation to those households that are missing out.
All right, Prof, we appreciate your time. Thank you so much. And you've also simultaneously answered the question of the possible alternative means. We appreciate your time here on SABC News. Thank you so much. That's Professor Ruth Hall from the Institute for Poverty, Land and Agrarian Studies, talking to us about possible malnutrition that we may face here in this country. As I said, we are taking a call, so let's take some of those calls then. I believe I do have Sylvester from the Western Cape on the line. A very good afternoon to you, Sylvester. What is your question or your input this afternoon?
Yeah, good afternoon. The question that I want to raise to the minister or to the government is, how is government going to deal with the social distance in the schools? Okay. Secondly, we see that in some rural areas, there is about 30 students in one room, in one classroom. So how is that teacher going to prioritize the safety of our children? Okay. You see now, some of the schools are not even fumigated yet now.
All right, Sylvester from the Western Cape, thank you very much for that question. I think it was a question that was raised by an earlier caller, and it is a big issue, no doubt. That's why I suppose it's being asked again about how, the government plans to watch for social distancing in schools. As we know that children don't necessarily know very much about social distancing, and of course prioritizing safety of learners in full classrooms. So those are some of the questions, and I suppose that the minister will then address this evening in her address, and we're about 20 minutes from that address. At 6 p.m. we're expecting the minister to communicate.